Hi, I'm Dr. Nikhilesh Pathak, general physician and diabetologist at Garam Hospital. Today, I'm here to speak about a very important and unnoticed topic, especially the person who are suffering from diabetes. So, diabetes, as we all know, is the world capital. India is the world capital of diabetes, and apart from diabetes, how we have to take care of our food and how we have to manage and how we have to identify the disease, because sometimes the patient is not aware, the diabetic patients are not aware of the basic things, and they find out that it's a normal, some clinical features they find consider it's a normal, and they ignore the symptoms, and later that leads to a bigger problem of blood vessels, and sometimes in the later stages it also causes the amputation of the leg and feet or maybe other body parts. So today I'm here to tell you about the diabetes and the foot care precautions, so everyone should know and and understand the basic signs and symptoms so the person can take care of it. So starting from very beginning, diabetes is a disease which affects the nerves and mainly the blood vessels of our feet, especially, and sometimes due to minor injuries or cracks or maybe some minor ulcers, person ignore it, but this can lead to the major wounds and the loss of sensitivity because of the diabetes, because of the nerve involvement, can cause different injuries which gets unnoticed and can lead to a bigger problem. So how the foot problems leads to the diabetes, and it weakens the nerve system, and it may, this leads to the injuries and further neuropathies. The first thing we find it out is there is the change in the foot shapes and the movement. So diabetes, it generally weakens our muscles and the ligament and the tendons which join the muscles to the bone. It also causes thickening of the ligaments, and later it causes the clawed toes. Sometimes it also causes a very big toe, and make our feet, our soles and legs unstable, and sometimes the person also feels of the tight ankles. So what happens is, due to abnormality, walking abnormalities, and change in the foot and the heels, it causes disbalance, gait abnormalities. When once we start walking, we cannot walk in a straight line, or maybe we just get disturbed gait and disturbed walking imbalance, and which leads to the injury to our feet. So mainly the foot problems which is linked to the diabetes is, sometimes the patient also feel that the patient is having a very dry and a fragile skin. So what happens is, diabetes also causes the dryness to our skin. So the skin starts feeling very dry and very crackled. So this makes the germs to enter through our skin very easily, and which cause, in case of small cuts or minor injuries from the corner of our bed, or while from doors, or from while getting out from the cars. So because of the dry skin, weak skin, the germs enters, and the chances of the infection in diabetes, it increases gradually as compared to the normal person. And because of the diabetes, the third point is, we have a decreased blood flow. So due to decreased blood flow, especially we are talking about the foot and the legs. So if there is decrease in the blood flow and in the legs, so it causes a narrowing of the blood vessels, and this cause delayed wound healing. So because the blood flow is not proper, so while due to the cracks, due to the minor injuries, the germs enter. But the main हमारे जो मोनोसाइट्स होते हैं, या जो हमारे जो antibodies, the circulating antibodies in our blood, they cannot reach to the target points because of the thin blood vessels, because of diabetes. So it causes that delayed wound healing, and the feet also feel cold of our patients, and the person also feel like very pain and heaviness in the legs. So because of the diabetes, the poor blood flow, it can cause the serious complications. So about half of the people with diabetes develops the numbness and loss of sensations, the weak. Is also diabetes also causes the nerve damages. So due to the nerve damage, the person feels the cold extremities, it feels the loss of sensations, and weak foot muscles, and burning and tingling sensations in the foot and in the legs. And we also have the cold extremities. So while the sensation is reduced, the small injuries like the blisters and the cuts are unnoticed, and the chances of progression of the disease because of the diabetes causes more in these patients. And the last is we have the Charcot foot. In some people with the nerve damage, the bones, as we discussed, the bones and the tendons, they get weakened, they get tightened, and the muscles also get weak, uh, leads to the collapse of the joints. This leads to the swelling and the redness in the joints, which we later called it's a Charcot foot. So, and if we do not do the early treatment, and it can cause the ulcers. It can due to minor damage also, it can cause the ulcers. And in later stages, if not if not timely diagnosed, if not treated timely, then the person can have an amputation, that is cut to the toe, cut to the fingers, or maybe the cut to the legs. So, as in a short form, the diabetes can cause muscle weakness, cold extremities, weakness in our legs, and because of decreased blood vessel flow, it can cause delayed wound healing, and the germs can enter because of the dry skin. The germs can enter into our skin, through our skin, and causes the serious infection. And then in the diabetes, immunity is also very low, so the chances of infection and the various complications and the symptoms can rise. So how we can prevent all those things? So we have to daily practice our practice foot cares, which includes we have to wash our feet daily, and through mild soap and through the warm water, and we have to apply a moisturizer daily, and we have to keep our feet and the toes clean, not any moisture or something like that. And secondly, nails, we have to trim our nails. We do not have to increase the nails, because if we increase the nails, then the long and the thick nails can rub against the nearby toes, and leading to the sores, and the chances of infection, especially the fungal infections, are on the very higher side. And the third is, if you wear the tight or the small size shoes, then also it causes the pressure in our feet, and later can cause the decreased blood flow. So we have to wear a comfortable and a good heel shoes. And if the person is having a flat shoes, the person should meet a diabetologist and or the vascular surgeon. So properly sole can be made, and the proper pressure can be applied over the sole, so the blood supply can be uh, proper. It should not be minimized, and uh, the good supply prevents mainly from every diseases. So if our shoes are uncomfortable, get it checked. And the fourth one is, the sugar patient should walk at least mild to moderate walk at least for 30 minutes, because walking and exercise, it improves the blood flow in our legs and in our feet. And fifth one is, like if we see there is any cut or in a wound, or we have ulcers, we can see like we have arterial and venous ulcers. It's a very small type of ulcers we notice in our feet, in our toe, and in our fingers, and we feel it like it's very normal. But in diabetic patients, This can lead to the serious hazards because of the compromised blood flow, and the chances of getting germs into the blood circulation is on the higher side. So if anyone finds there is a very small ulcers or the redness or swelling in the feet, toes, or anything, or any discharge from the feet, and if you notice anything, do not ignore, because it is a sign of serious injury to the muscles, to even it can reach up to the bones, and and it can compromise the blood supply, and it later decreases the blood supply and cause the blackening of the toes, and later when there is a decreased blood supply, or when there is when there is infection, then we have to cut that part. So better, if you find anything, in contact immediately, do not ignore and do not wait for the consequences. And if you find any thick yellowish ingrown or infected toenails, like if you find any yellowish there in the nail bed, or any blackish in the nail beds, or corns, or in the calluses, get treated immediately. And and if you find that if there is any sudden swelling, or in the hotness, or in the, or some redness, pain in your joints, especially in the feet joint, then it is likely a chances of the Charcot's feet. So again, yeah, if you find any symptoms, get it checked with your nearby dermatologist, endocrinologist, or a vascular surgeon. Thank you so much.